Live. If you're in the chat room, go ahead and say hi. I'm going to get K.K. McInerney, the press secretary, going. She's putting on a conference. I heard a little bit of it. I was actually sleeping through most of it. And a wonderful nap, which is really the only way to do this. And then I checked it out. I went to MSNBC to see if they had it. They didn't have it. CNN didn't seem to broadcast it. I could be wrong because this is after I woke up from my nap. Fox covered it, but so she's lost 2 of the 3 networks. I'm sure we'll hear from the president about that later. The president's been busy today. You know, all of this, that's, I don't know, 40, 50 tweets. We can find out, but I don't care enough. Of course, this morning was the court argument in front of the Supreme Court with his lawyer saying, well, turning over his tax records from several years ago is just going to cause an undue, but he's too busy. Show me the burden. So it'll be interesting to see how that goes. In the court argument, at least, it certainly looked like the 2 prosecutors, 2 plaintiffs, this is not, one of them is a criminal trial. Anyway, there's 2 cases. I won't get into it. It looks like the good guys won. It looks like Trump's tax records are going to be released to the Congress and to the courts, not to us. So if they're released to Congress, we will see them because they will get leaked. If they're released to the courts, we might not see them. There's hope, but maybe not. The bottom line is he's being forced to do this. Okay, hey, so Trump's not going to be here. Noel, hey Liz Dog. So we are going to get going here with Kaylee Manner, all about the testing. Let's do this.
1. I want to highlight 3 critical aspects of President Trump's response to the coronavirus that have
Let me know how the volume is.
The media's expectations and should inspire confidence in every American.
Oh, I got to be quiet and all ADSM. Is that it? I don't even know. ATST, HDHD. I got to be quiet because Kevin Lee Daughter's broadcasting in the other room. So, by the way, big news of the day: Kevin Lee Daughter tested negative for coronavirus, which is fantastic. And also, like, oh man, because if she tested positive, that means she's over it, she's had it, and theoretically, immunity's not the right word, but you know what I'm saying. ASMR. Thank you, Kim. ASMR. So I've got to be quiet. I can't get too excited about this. So she tested negative. We're waiting for the results on Kevin Lee's son. It was an ordeal getting her testing. Regardless of what is said in the meeting today, no, you can't just get a test. This is Seattle. And if you watched Rachel last night, nope, maybe it was Brian Williams, whoever it was, they had Mayor Jenny Durkan on, mayor of Seattle, and she was saying, yeah, we don't have enough tests. And we don't. I could not get the kids tested last week. We had to do it through a surveillance program through the University of Washington, which was free. I could schedule, if the kids had enough symptoms, I could schedule them. Most of the testing is done through your health organizations. For example, if you're with Premera Blue Cross or whatever. But you have to have the insurance for that health organization. And then you have to make a doctor's appointment. You have to go in and see the doctor, with the other corona patients, and then get a referral to go through a drive-up testing. Now, the big thing is that South Korea, which everyone sets as the gold standard, right away, they're just like, come on up. Symptoms, no symptoms, get on out here and drive through the drive-through, and we'll give you a swab up the nose and a double cheeseburger. And they've had 258 deaths total. And we've had, I think, 178 million. That's the number of brain dead people in this country. 80+ thousand. I haven't even looked in the last couple of days. I can't, people. Okay. Anyway, so she was negative, which is good, but also, well, actually, it is good because if she was negative, she had to be sequestered in a room here for a couple of weeks. But of course, there's still the danger of her continuing to be positive if she was positive, and then I get sick. And come on, nobody wants that. And that's the important part. So let's get going with Kay. Hey, everybody. Hey, Daniel. Hey, Lizzie. I said Lizzie already today. This morning. Okay, I said hi, Lizzie. Hi, Kim. Hi, Robin. Hey, Rich. Hey, Betty Sue. Wow, this is, everybody's here. All right. Hey, Joanna. Hiya. Speaking of testing positive, Joanna's dad has been testing positive now, I think, for 4 years. It's insane. No, but seriously, Joanna, maybe share, if you don't mind, when your dad first got the first positive. It's insane. And then just retested positive a couple days ago. I'm sure I got that information wrong. But let's get going with that. Here we go.
Across this country. Rest assured, the Trump administration is working tirelessly to defeat the invisible enemy.
Let me know if the volume's not
First,
good.
contrary to some media pronouncements, the United States did not need the 1 million ventilators thus far that the media said we were in dire need of.
No.
In fact, it's encouraging to be able to say that every
In
single
fact,
American
okay.
who needed a ventilator.
Right off the bat here, no. The media was not saying that we needed 1 million ventilators. There were estimates of about 800 and something. In fact, I was just looking at this. Hold on. 800 and like 900,000 ventilators worldwide. The media was, and this was a study, an academic study. Oh my God, I got it right here. What is it? Yeah, the National Health Service. I don't think they did the study. Hold on. Global data estimates. The U.S. needs 75,000 ventilators is what the estimate was, and that was on the high end. So this darn left-wing lame street media with their 1 million ventilators. And that being said, she's saying that the media wanted 1 million ventilators. We don't have anywhere close to we don't have 100,000 ventilators. We never got the 75,000 ventilators. We got lucky because the American people locked themselves down. But yeah, let's go right after that media.
Ventilator has received a ventilator. And this administration has managed to procure, 100,000 ventilators to be manufactured in 100 days. That's extraordinary. That's 3 times the amount produced in the average year. Likewise, there was some concern about N95 respirators, but the Trump administration has now shipped over 90 million N95 respirators. Once again, that is more than 3 times the average healthcare industry consumption of N95 respirators.
Right, and we have a pandemic, and the healthcare industry needs far more respirators than that. That's not even close to the level needed. Right now, if you work for the VA, you're being told you get 1 ventilator a week. A respirator, the N95 masks. Pence made that mistake a couple of months ago, and Dr. Fauci laughed out loud. Look up Pence and Fauci in my timeline, and you'll see a video of Dr. Scarf could not hold herself. It wasn't Fauci. It was Dr. Scarf. So look up Bricks and Pence on my timeline.
Respirators in the typical year. Finally, the U.S. now leads the world in testing. For weeks, the media cited South Korea as being the gold standard for testing, but as it stands, we are now testing at a higher rate per capita than South Korea. And in fact, as this chart is going to show you, in all 50 states, we are now testing at a higher rate per capita than South Korea.
Yeah, if you watched the broadcast yesterday, I pointed that out. The broadcast yesterday was Trump saying oh, we're going to get all the states the stuff they need to be testing higher than South Korea. Of course, South Korea tested early and often, got way ahead of the game, controlled the virus, and now they've had 250 some deaths. I have that chart pulled up as well. Here's us. I'll zoom in for you in case most of you guys have seen this already, but I'll just show anybody new here. This is January. This is when the virus got to both South Korea and the United States on the same day. We think that U.S. had a case right before that as well. But anyway, here we have 11 tests on January 21st. By the time you get to March, South Korea had already tested 178,000. So basically 180,000, and the United States was still down at about 3,700. So there's the difference. It's not too many tests. It's still too little tests. Way too late. We let the virus seed and germinate, and that's why we are where we are today with 1.3 million cases. To me, it's weird. I haven't looked at the stats, and it's only been a day. I looked at the stats Monday. I was like, I haven't looked at the stats in 3 weeks. Oh God, it's just Tuesday. Back to KK.
So a state in this country is testing at a higher rate per capita than the entire country.
Look at that. They made a slide for it. They're bragging about, yay, we're doing way more tests than the country that doesn't need to do tests because they controlled it. We're the best. Go testies.
Country of South Korea. That's.
Hey, welcome to Chris Wilson. Chris, I'm being quiet because Kevin Lee Daughter's live streaming as well. Or maybe she's not. Anyway, I've been told to shut up. Chris is the newest patron. So Chris is this broadcast brought to you a little bit by Chris Wilson. So thank you, Chris. I appreciate it. I'm looking at the chat room like you. Thank you, Chris. I appreciate it. Thank you. So everybody say thank you to Chris. In fact, a whole bunch of supporters are in here. So thank you. If you'd like to become a patron and help me out doing this, still no unemployment insurance. Here's what I found out yesterday. This is a sidetrack. Anyway, if you'd like to, I'm like the president. I can't even complete a sentence today. Just leave it there. KevinLeeFather.com takes you to Patreon, and you could decide I'm going to give you $1, I'm going to give you $5, I'm going to give you $48,000.68, which was a weird level to set, but I'm all about why is 500 gold so much better than $4.99, right? Just because we live on the 10-base system. Look at everybody actually saying thank you to Chris. All right, that was worth every penny. So Chris pledged 38 cents a month, and every little bit helps. That is $1.48 the cup of coffee. So thanks, Chris. That's really so generous of you. I'm kidding. He's. I don't know. Maybe on this, I don't know if you can see how much people donate on the site, but there are some big contributors, and I greatly appreciate it, all of you. It is gaslighting, Rob, and I do nothing but lies. Oh, Kristen, you're not working? You're a Canadian, too. Okay, good. Well, you're welcome. We welcome everyone of every race, creed, and color. Even KK McInerney. Let's get back to her. I was going to say something else, but, all right.
Pretty extraordinary, I would say. Now I would like to provide
I want to see what's pretty extraordinary. I think it's probably the South Korea thing.
At a higher rate per capita than the entire country of South Korea. That's pretty extraordinary, I would say. Now I would like to provide the American people with an update on the Trump administration's support for underserved communities.
Kirsten, Kirsten, I keep calling you Kristen. Need new readers. Kirsten, if you, I'm a Canadian. I'm a dual citizen, actually. So if you find out that I can come back and get $2,000 a month, I'm getting nothing here. I got my $1,200 check. Kevin Lee's daughter didn't get hers. If you go to the IRS site, there's no explanation of why and why not. There's supposed to be a $600 in your unemployment no matter what, even if you're a private contractor. And I found out yesterday that I'm getting screwed because, see, I'm an actor. And so some of the stuff I do is private contracting. Some of the stuff I do is I'm an employee for like a day or 2 or 3. You get screwed. You have to do one or the other. And then because of it, you're not getting the $600. I don't even know what the rules are, and it seems that most of the states don't know what the rules are. So there's a petition somewhere. I might share it, asking people to fix that so that musicians, artists, etc., who are sometimes contractor and sometimes employee, can stop getting screwed. Because, I mean, how many musicians have a stockpile of cash?
As the president has said, this country is at war with the invisible enemy, and while we all...
I do spend time there occasionally, Kirsten. It's been a while, but I go for Canucks games.
Fight the virus as one united American people. It is a fact that this virus disproportionately has affected those in medically underserved communities. And therefore, the president has committed to delivering economic support.
Okay, so sorry, let's go back. I keep interrupting her. She's talking about the minority communities, African Americans, Latinos, etc., being affected at a higher rate with this virus, and there's a number of reasons for that. No one's really sure exactly medically why, but let's move on.
Proportionately has affected those in medically underserved communities. And therefore, the president has committed to delivering economic support and quality care for individuals.
Joe, Obamacare saved my life. I had a heart attack, and I had Obamacare at the time, and if I didn't have Obamacare, I would be dead because I wouldn't have gone in. I didn't know that I had had a heart attack. But having insurance, I was one of those people who's like, well, now before insurance, I had a catastrophic. I've always had insurance, but before Obamacare, there were these catastrophic plans, and no one would give me a real plan for less than $1,200 a month because I have a pre-existing condition. I have a couple of them, neither of which actually affect my health, but that's neither here nor there. Anyway, yeah, without Obamacare, I'd be dead today, which would make the broadcast extremely boring. But at least it would progress instead of this nonsense.
Schools in distressed communities. The Trump administration, as I announced last week, distributed $12 billion in provider relief payments to 395 hospitals across the country that have been hardest hit by the coronavirus. Many of these hospitals were in underserved communities, and to ensure even more funding to these communities, $2 billion of that overall funding was specifically targeted to hospitals in proportion to the amount of care they provide for low-income and uninsured patients.
Okay, did you guys catch that? Kirsten, you should have caught that. Uninsured patients. Why do we still have uninsured people in this country? That's the problem. The fact that rural hospitals are having trouble right now and closing down, which has long been a problem, but more so right now because they can't do elective surgeries in some areas if the governor says don't do it. The fact that that's happening is because the system is broken. We're making profits off of people getting sick. No sense whatsoever. And by the way, most of that money that she's talking about went to rural hospitals hardest hit by the coronavirus. Well, I can't say that. I don't know that for sure. But the rural hospitals are almost all in Republican areas, many of them in the 19 stupid states, the Republican states, who didn't expand Medicare. And so you end up with all these people that are uninsured. Plus, it's awfully confusing. I have a solution for health insurance, but we're not going to talk about it right now.
Additionally, the Trump administration is investing nearly $2 billion in community
I'm glad I'm here
health
too, guys.
centers
Thank you.
to help their 28 million patients in medically underserved areas that receive care and the testing they need. That's what this funding is
Rural
intended
hospitals.
for. And additionally, there's $583 million awarded to 1,385 health centers in all 50 states, the District of Columbia, and the 8 U.S. territories
centers are good.
specifically geared towards testing. These health centers currently provide 100,000 tests per week, and 59% of the patients tested last week were from minority communities. Finally, under the Paycheck Protection Program, the Trump administration has done extensive outreach to the community development financial institution funds across the country. These are known as CDFIs, and they support revitalization and distressed communities. In the second round of PPP, 100,000 loans have been distributed to CDFIs and to MDIs, which are known as minority deposit institutions.
Great. Make that public.
These have amounted to about $6.2 billion. And finally,
Make that information public.
570,723 loans have been issued to smaller lenders and non-banks, and these loans have amounted to $29.9 billion. President Trump will continue to fight for the health, safety, and economic well-being of all Americans, especially those impacted in low-income communities and disadvantaged communities. And with that, I'll take questions. Yes.
President Trump yesterday said the U.S. had prevailed on testing, but today we heard from senators, both Democratic and Republican, who say that's not the case. Senator Lamar Alexander, a Republican, says what our country has done so far in testing is impressive, but not nearly enough. Senator Patty Murray, a Democrat, said we need dramatically more testing. It's unacceptable. We don't have a national strategic plan. What's the White House response?
Well, first I would note the words of...
We're awesome, so screw you.
Dr. Anthony Fauci, which is this: we will have and there will be enough tests to allow us to take this country safely through phase one. I sat in the...
Not what Dr. Fauci said in mid-April, right after the tax day. So, or was supposed to be tax day. So April 17th, 16th or 17th, Fauci said, I'm confident that if we keep going at this rate, if we follow everything and do everything right, we will have enough testing to get to phase one eventually. He didn't say what she just said.
The words of Dr. Anthony Fauci, which is this: we will have and there will be enough tests to allow us to take this country safely through phase one. I've sat in the task force meetings where Admiral Joie has talked to governors and literally pulled out his chart and said, Governor X, here was your...
I've seen those meetings where Admiral Joie says we're going to have 27 million tests by the end of March. As someone pointed out earlier, he didn't say March 2020.
Your plan and your request for testing in order to safely reopen, I can assure you that that will be satisfied this month. So I have seen those meetings take place. I can assure the American people, in line with what Dr. Fauci has said, we do have enough.
I've seen meetings take place, so you can take my word for it.
For phase one, by the end of the week, we'll be able to say that we've conducted 10 million tests. You know, we went from doing 150,000 tests per week to now testing about 300,000. That's an extraordinary effort. Not to also note that that's 2 times what other countries are doing when you look at America's testing. I'd say that that's pretty impressive, and that's a testament to the work of this administration and the hard work of...
We don't know how many China's testing, and they have the world's largest population, but... Anyway.
The private sector.
Hey, about reopening schools and also vaccines, if you don't mind. First of all, reopening schools. There were a lot of questions today up on the Hill about when indeed that can happen. When will the White House issue guidance benchmarks for various communities on when that can happen and how soon that can happen? There's a lot of concerned parents, as you know, across the country.
Yeah, well, in our guidelines to safely reopen that are data driven, it is phase 3 where there is an outline to beginning to open.
The guidelines that none of the governors are paying attention to. Sorry, none of some governors. I'll phrase it like Trump. If you take the ones that aren't paying attention to it, 100% of them are not paying attention to it.
Schools. So currently I direct to our guidance that currently exists, and there is that CDC guidance that is in the works that is forthcoming that will provide additional detail.
That CDC guidance that they buried, that they've now had for 18 days, they've been editing the new CDC guidance, which has already been leaked to the AP. You can see the guidance, but they've been editing it for 18 days, during a pandemic.
Okay, in regard to vaccines, the question was asked when and if a vaccine becomes available, regardless of income, can the president ensure that everybody will get the vaccine, regardless of income?
Look, the president will go to great efforts to ensure that. I don't want to get ahead of any announcement on his part, but I would say this, that when it came to testing, there was that same question. What if I'm uninsured and don't have the ability to afford a test? This president, before it was even addressed in Congress, called in the private sector and got companies to say, yes, we will cover both treatment and we will cover testing, and then eventually that was inscribed into law. So this president, before it was even an issue on the Hill, took great measures with testing, and he will do the same for vaccines. And I would just note, as Dr. Fauci said on the Hill today, there are 8 vaccine candidates, and on January 10th, we received the genetic sequence. The 11th, there was a plan developed. The 14th, development began, and 62 days later, we entered phase 1 clinical trials for a vaccine, which is the fastest ever in Dr. Fauci's knowledge, at least. So that's a pretty good pace that I think we're on to getting that vaccine.
Is the president working with pharmaceutical companies? He met with executives back in April. Will he work with them, encourage them to make sure that vaccines are affordable to everyone?
Absolutely. There's no doubt about it. Yes, we do.
Thank you and welcome. I haven't had a chance
Thank
to
you.
do that in this room. I have a couple questions. First, on reopening. Dr. Fauci today stressed many times that reopening without following the federal guidelines and the gating criteria could lead to more outbreaks.
LG, if you're just joining us, let us know. I don't know if you were here at the beginning. Something to show you. So LG, thanks for being here. It helps the numbers, but I just want to show you something if you're new here. So please let me know if you're new here.
And could turn back the clock. Does President Trump still believe in these federal guidelines? And if so, why isn't he urging states to follow them instead of asking them to move quickly?
She should ask China.
Well, he has encouraged states to follow the guidelines. That's still consistently our recommendation today, that you should follow the phased approach to reopening as outlined in the data. I do want to stress, as the president has stressed, that we do want to reopen this country because there are consequences that run the other way when we stay closed down as a country, and I want to run through a few of those with you. A hotline run by the Substance Abuse and Mental Health Services saw a 1,000% increase in responses during April as we kept this country closed. Epic's data said appointments for screening for cancer of the cervix, colon, and breast were down 86% and 94% in March. There
Yeah,
are real
'cause people are
consequences for
scared.
that. I'm a BRCA2. I carry a BRCA2 mutation, so I was someone who was regularly screened for breast cancer until I got my mastectomy. And when I went to my cancer hospital for screening, I didn't see as many people in the halls, and that is quite frightening because the consequence of that is this.
It's her scientific study. But yeah, she's right. A lot of people didn't go to the doctors. We can't say that everyone who wanted a ventilator or needed a ventilator got one, because a lot of people stayed home scared that if they went to the hospital, they were going to get sick and then died at home, because the disease part of the symptomology is it can come on very suddenly.
According to the IQVIA Institute.
And of course, that includes everybody who couldn't get tested because their symptoms weren't severe enough without a high enough fever.
For Human Data Science, a total of 80,000 plus diagnoses of 5 common cancers in the United States are projected to be missed or delayed during the 3-month period of early March to early June, which is why this president has always said, go to your doctor, do your screenings. There's a way to safely do this. If you feel chest pain, go to your doctor. We can't scare people from going going to hospitals. It's a consequence of staying closed, though. When people are scared, they're scared to even go to their doctor, and there are consequences for that. And finally,
I'm not convinced he said that.
A recent CNN article from Friday noted a national public health group that warned as many as 75,000 Americans could die because of drug or alcohol misuse and suicide as a result of the coronavirus pandemic. So there are consequences
that's not
to
what they
us
said.
staying closed, and it's why I believe it was 8 medical groups came out with a statement. 8 medical groups noted concerns that some people with symptoms of heart attack, stroke, and cardiac arrest are avoiding hospitals. So it's why
I just looked up whether or not the president has ever recommended that if you have chest pain, go to the hospital. Here's the search. Chest pain, no mention of chest pain his entire public life. Moving on.
said from this podium, I think at least 2 times, today is the 2nd or 3rd, you've got to go to your doctor. We've got to encourage this country to safely reopen.
Last week you said it would be nonsensical to test all Americans, and yesterday the administration celebrated testing 2.7% of the population. In order to reopen 100% of the country, what amount of testing does make sense to you? And what's an alternative to testing to track and contain the virus?
This administration is not about making sense. This administration is about serving the American people.
Strategic testing, which is what our experts have always said. Look, you know, you had Admiral Joie who said it's a bad strategy to say that you need to test everyone because testing a person now just means they're negative at this moment. A point also emphasized by Dr. Fauci. If you get a test today, that does not mean that tomorrow or the next day or the next day or the next day you might get exposed, which is why we acknowledge testing is not preventative. What is preventative is wearing this mask. What is preventative is social
which she's not
distancing.
wearing.
What is preventative is washing your hands. These are the measures we need to take to safely reopen. And then we'll use testing strategically for contract tracing purposes, for example. So that's the way it should be used and deployed. And I stand by the comment that I made earlier. Yes.
Caitlin, could you speak just a bit about...
Salt, take care, or Sab, take care of yourself. Yeah, you got to go to the doctor if you're sick, unfortunately. But yeah, wear a mask, bring the hand sanitizer. Hand sanitizer is more abundant now. Pretty much everywhere I've gone, there's been hand sanitizer available, especially doctor's offices. I went and gave blood on Friday, and they had plenty of hand sanitizer, so that's good to see. I hope that's the case around the country.
The next round of coronavirus funding, the bill that the Speaker is releasing today, what provisions are a no-go for the administration? What can you get behind?
Look, I won't get ahead of the president's in negotiating, but and I certainly won't condition any future legislation on a certain proposal. But I will say that the president
that mask is not
noted
preventative for you.
Payroll tax is something that he's looked at, not conditioning it on that,
Good
but
point,
noting
Airbus.
that something he desires to see, and it's smart policy. In fact, according to Stephen Moore and Art Laffer, this means, quote, every worker in America would get a substantial pay raise. And what is so promising about the payroll tax is that it's a regressive tax. So the lowest wage workers are in fact the ones who would be most helped because they pay more payroll tax than they do income tax. So that's something the president's mentioned, not necessarily as a condition. I won't negotiate here with Speaker Pelosi, but I encourage her to work with the president and help these low-income individuals get this tax cut that they deserve.
But again, if you don't have a job, you don't get a paycheck, the payroll tax cut does not help you.
Yes.
I'm sorry. Michael Pack has a confirmation hearing on Thursday. Could you speak to what the president wants him to do if confirmed?
That is not how you wear a mask, by the way.
The Voice of America operates.
Yeah, I won't get ahead of that hearing, which is later in the week, as you noted. Yes.
Thanks, Kaylee. I wanted to ask you about the task force. The president and the vice president said last week that there would be some new additions to the task force and that those would be announced on Monday. We haven't seen those names yet. Do you have any update on that and whether there are going to, in fact, be people?
He also said that last Monday we would get the intelligence that he was given in January and February, telling him about the coronavirus and warning him that it was going to be a pandemic, which he says they never made it seem like a big deal. He said that last Sunday, 2 Sundays ago on Fox News doing his town hall. He said they'd be released the next day, that 2 Mondays ago. Still nothing, which is so weird. And now he's asking the question about when are we going to hear about those new members on the task force that we were supposed to hear about yesterday. My question is, remember that business task force, Reopening America business tasks extravaganza that we heard about in the middle of March? Or was it April now? Jesus. April? Whatever. Again, It never came into being.
We'll add it to that task force.
Yeah, there will be additions, but no announcements on that just yet. Jeff?
I think, Caitlin, there were some deaths in St. Petersburg today from ventilators, Russian ventilators.
Oh, look, he's got a KN95 mask. I'll show you guys. So this is the Chinese standard for masks. This is the mask that I have. It's not medical grade standard in the United States, but it's still the 95. So it's the N95. But the reason it's got the K in front of it is because it's not good enough to be used in a hospital here. But in China, you can use it in a hospital. And oh boy, the number of medical personnel here that have gotten sick and died, it's just beyond belief. Why? Because we haven't given the amount of PPE and because we've been unprepared. I wish that Obama had left us some sort of pandemic game plan and there were guidelines.
That exploded. I'm wondering whether you can tell us what happened to the Russian ventilators that were sent to the United States and whether those ventilators have been used, and if not, if they're being taken out of commission.
Okay, that's the first I'm hearing of that story, so I don't have any updates on that other than to note that we are way ahead of where we should be on ventilators. As I noted in my opening remarks, 100,000 ventilators in 100 days is really good, and no one has died for lack of a ventilator, but that's the first I'm hearing of that story.
Again, you can't say that, but...
Yesterday, the president indicated that he might be communicating with Vice President Pence by phone for a while, while the Vice President keeps some distance. Can you give us an update on whether or not those two men are going to see each other in person, or whether, I know the Vice President has been working at the White House, is he keeping his distance from the President for a while?
Now, the Vice President has made the choice to keep his distance for a few days, and I would just note that that's his personal decision to make that. As to how many days he does it, again, that's a decision for the Vice President.
So following the
A
guidelines.
related question. When is
For a
the
few
next
days.
time that we might see Dr. Birx and Dr. Fauci
Hey, Martha.
here in this room giving us an update on kind of the status of the public health regarding coronavirus?
Look, we've heard from Dr. Fauci pretty much the entirety of the day. He had a hearing, as you noted, so you've probably heard from him more hours today than you've ever heard from Dr. Fauci. You hear from these experts regularly out on television, and we'll see the next time they're up here in this capacity, but we certainly have valued their time, and we continue to value their time.
It has been a while since we've seen Dr. Birx, though, for example. I mean, she is the coordinator of the coronavirus task force. When might we see her and be able to get an update from her and be able to ask
where is
questions
Dr.
of
No,
her?
we saw
Yeah,
Dr.
again,
Scarf yesterday.
I don't know when in this capacity you will see her, but I talk to Dr. Birx regularly. In fact, I talked to her just before I came out here because I had some questions about some funny numbers I heard from Senator Elizabeth Warren, and she helped me to correct those numbers, which I'd like to correct here because I think it's unfair to the American people to give inflated case numbers and mortality numbers because it leads to those same Americans making the decision to not get a mammogram, to not have the cancer screenings they need. So I'd like to just reveal to you some information Dr. Birx just shared with me. Elizabeth Warren erroneously said there were 25,000 new cases today. In fact, there were 20,000. Senator Warren said...
Oh, okay. So let's say I'm going to go get a mammogram because honestly, I've been eating a lot. And I look and say, I'm not going out because Elizabeth Warren said there were 25,000 cases. Wait, there were only 20,000 today? Oh, okay. Well, then I guess I'll go to the doctor. That extra 5,000 really... I'm going to look that up, by the way. I'm sure Elizabeth pulled off of World Stats. Let's look it up together. This is how you look this up. You go to Worldometers, which works sometimes. And 20,000 new cases so far today. Let's go to yesterday. See, I don't know if you guys can see that. Let me take a look at what you can see. So when you're on this page, let me zoom in for you too, because I know you guys, some of you are watching on phones. So right here, this is now 20,000 new cases. Let's go to yesterday. And, only 18,000 new cases. So Elizabeth was wrong, off by 5,000. And because of that, people are going to get breast cancer. So what are you going to do? Let's make that go away. Here we go. No, we're not going. We
There were
can't. There it is.
2,000 deaths. In fact, there have been less than 1,000. I spoke with Dr. Birx about that. So I'd encourage our
Wait, what did
Democrats
Elizabeth
today.
say?
In fact, there were less than 20,000. Senator Warren said there were 2,000 deaths. In fact, there have been less than 1,000. I spoke with Dr. Birx about that.
Today-
So I'd encourage our Democratic colleagues and all Americans to make sure we're putting out their good information because it does have consequences. Yes.
Thank you. The Justice Department is considering bringing federal hate crime charges
Wow, if they're going to be that picky about the figures,
against the two men charged with murdering Ahmaud Arbery. Does the president think that's
this is the administration that has never gotten the number of countries correct. President Trump has probably said it 60 times, not once.
appropriate?
Look, I'd refer you to the Department of Justice statement, which is this, that we are considering the request of the Attorney General of Georgia and have asked that he forward to federal authorities any information that he has about the handling of that investigation. We'll continue to assess all information, and we'll take any appropriate action that is warranted by the facts and the law. And the president, I've heard him say it to me personally, his heart breaks for the family of Ahmaud Arbery, and we want to see justice in that case as the facts lead us to that place.
And for all the American people.
White House staff yesterday were asked to wear masks around the West Wing, except when they were seated at their desks. I can't help but notice you're not wearing a mask. What's the reason for that? Is that a television thing, or?
No, it's because I'm distanced from you. You'd probably have a hard time hearing from me right now should I have a mask on and that be
No,
muffled.
I can hear
delivering
him.
information to the American people. I'm an appropriate distance away. I had a negative test today. I had a negative test yesterday, and I'm in an okay place. Yes.
Go ahead. On Afghanistan, if I may.
Wait, if these tests are not prevention in any way, why does she keep having a test every single day? I heard that Dr. Fauci said that you should never get tested. That's what I heard.
President Ashraf Ghani has put his troops on an offensive footing. Has President Trump spoken to him about that? And what does it mean for the US-led peace process?
Not that I'm aware of, and I don't have any new information on that. Yes.
We're seeing a White House report on locations to watch and with increased cases. Can you hear me okay?
You said locations to watch?
Locations to watch with increased cases. And
Okay.
we're seeing rates spiking in several spots in the Midwest, including Kansas City. Is this a concern of yours, and can you address it?
I did speak with Dr. Birx about this just before coming out, and I think you're referring to a document that was put out that wasn't a White House document. It was a FEMA document that looked at what was going on in the Midwest, and
Oh.
she made the point to me.
So since it's a FEMA document, it's discounted because it's not coming out of the White House.
She showed me a document that showed that these are isolated outbreaks that where there are specific instances in, let's say, a meat processing facility or a prison where we isolate that there's a problem. We're able to contact trace and pretty quickly resolve the situation. She pointed out that in Des Moines there
How do you resolve the situation without a treatment or a cure?
was a Dairy County meatpacking facility, and that was a good example of where we were able to do that. So I would just say that, and this was a quote, this is proof that the system is working, that we're able to identify what the president said are embers and put them out. It's the system at work. Yes.
Yeah, you mentioned as an example
Because some people are just going to get better and some people are just going to die. And we've put the fire out.
of the risk of not closing, people not going to medical appointments. How do you extend that argument to restaurants, nail salons, barber shops and beauties? Are those the kind of essential things you're talking about?
What I'm talking about is we have a phase plan to reopen, and you can follow those guidelines, and the restaurants are in phases, and the entertainment facilities, you noted, are in phases as accordance with declining cases. But as a whole, with the totality of the circumstances, when you have a society that's shut down and people are locked in their homes and they're isolated, it leads to the very suicide line increase calls that I noted. It leads to drug abuse. There are consequences to eternally staying shut down, which is why you have to find the balance, which the president does.
There are studies linking unemployment to being shut down. So, yes, but none of them link anything like the level of what we're seeing in terms of 80,000 dead. Not even close.
In consultation with expert advice from Dr. Fauci and Dr. Birx and the task force, and he makes the best decision for America going forward. He made the right decision to shut down the country at the time he did because there were 2.2 million lives at stake, and a lot of American lives were saved because of that decision. But at the same time, it's a balance, which is why we put out the phased guidelines to reopening.
And I also wanted to ask you about a statement that Dr. Fauci Fauci made today. He said, I think we are going in the right direction, but the right direction does not mean we have by any means total control of this outbreak. How does that square with the president's statement yesterday that we have prevailed over the outbreak?
Well, the president made clear he was talking about testing. The fact that we can say we're doing double that of any other country, the fact that we can put up that graph that shows South Korea as a small little red bar of testing per capita.
We're not doing double.
And
Hold on. They always show the graph, and they show it without Russia. And Russia, let's go to Russia right there. So, oh, wait. Okay. It's not showing the U.S. at the very top of the map there. Okay, so the U.S. is about, the U.S. is 9.5, and Russia is 5.8, almost 6. 9.5 is not double 5.6. So, again, just like why? We're doing more testing than any other country. That's good. Just leave it there. You don't have to say, like the president tweeted this morning, that we're doing more than all other countries combined. We're not even close to doing more than all other countries combined. We're not doing double what Russia. Why? It's completely pointless lying. It's just to boost your own bravado. Bunch of testes.
Every bar beside it is an American state or territory outdoing what South Korea has done. And let's note that South Korea was the gold standard for testing. In fact, on March 13th, the Washington Post headline was, South Korea is doing 10,000 coronavirus tests a day.
Yes.
The U.S. is struggling for even a small fraction of that. And here we are on May 11th with a Washington Post headline. The administration keeps bragging that the U.S. testing now is better than South Korea's was a month ago. So you can't demand that we reach South Korea and then say that we're bragging when we do. This is a moment where the American...
South Korea tested early. The United States screwed up the test. We had no testing. That is why we have more than 1 million cases. You can't test later. This is like showing up in the fourth quarter of a basketball game and saying, we scored 37 points, which is more than any other team has ever scored in the fourth quarter of a game. Meanwhile, the other team has killed 80,000 of your fans in the first 3 quarters.
American private sector succeeded. This administration mobilized that testing. Every state is better off than South Korea at this moment. And that is a very good thing and something to be celebrated because it's American innovation at its best with 92 emergency use authorizations.
I wonder how many American states have more deaths than the entirety of South Korea.
And it's this administration under President Trump working.
But does the president agree with Dr. Fauci that we do not have total control over this outbreak?
The president believes in the phased guidelines to reopening, which Dr. Fauci signed off on along with Dr. Birx, and we encourage every state and governor to follow.
Encourage.
Thank you, Kayleigh.
The states aren't following it.
That Florida has so much testing that testers are literally sitting around waiting for people, and that there is a, quote, great overcapacity. Yet the reality in the state is there are still widespread criticism, reports of not enough testing. In the Kaiser Family Foundation ranks Florida 24th in the country per capita when it comes to testing. So is the president being overly optimistic about the situation in Florida?
Not in the slightest. I was actually in the Oval Office when that discussion transpired, and the governor of Florida, Governor DeSantis, who's doing a phenomenal job, talked about that there was over testing ability at these sites, so there were extra tests. There wasn't enough demand. There weren't people showing up to use them all.
Yeah, I've spoken to people in Florida. They can't get tested.
He said that had happened around some sites in the state. He saw it firsthand. He's the governor of Florida, and that's a good thing. And we're able to fulfill Governor DeSantis's plan in full that he has laid out as necessary to reopening the state of Florida, which happens to be my great home state. Yes.
Data does not support that, Kayleigh. So is the president just...
She's from Florida.
Listening to the governor, or is he looking at the data?
Oh, he's looking at the data. As I noted to you, Admiral Joie has a chart of every single governor's plan and has said we will fulfill every single governor's plan. Governor DeSantis was reporting what he had seen at distinct facilities or drive-through testing sites.
Yes. With the restarting of the economies on both sides of the Canadian and U.S. border, you know how much trade between the two sides are essential for communities. Can you update us on the plans for reopening and also a timeline for reopening the border?
Yeah, no announcements on that front today. Yep. Chanel?
Thank you. With the release of the
Oh, this is the OAN. We're going to get an Obamagate question here, I bet.
A timeline.
She's probably in the very back. OAN isn't allowed to sit in the room anymore because they weren't obeying the social distancing guidelines. Because, OAN. If we get a shot of her, what are the odds that she's wearing a mask? We'll find out.
For reopening the border.
Or she's wearing a mask, and when she begins to speak, she just takes it off. Also possible. Anybody want to lay odds on that? If you're watching on YouTube, you're only like 10 seconds behind, so you might get it in here before I hit play.
Yeah, no announcements on that front today. Yep. Chanel?
With the release of the transcripts related to Adam Schiff's Russia probe this week.
No mask. Standing in the back. OAN. OMG. And let's see what the question's about.
Is there any information you can share with us as to what the DOJ has shared with the White House on whether it is investigating Obama administration officials on this matter?
So I don't have any updates on that front because that's currently...
I don't even know why we're watching. I mean, we know what's going to happen. We know what's going to be said. This is like... it's like watching a replay of a football game where you know the winner.
A DOJ matter, but you did refer to transcripts.
And the loser is the American people. Someone's doing a drinking game. Was it Marfa? Who's doing the drinking game? Because I said American people. I just said it twice. So every time I say American people, you have to take another drink.
I do think it's an important moment to talk about what was in some of the transcripts that were released prior to today, so not the specific ones that you're asking about. But we learned from newly released transcripts a few things. We learned that what some Obama officials were saying publicly was much different than what they were saying privately.
Nope.
James Clapper was out there saying that he had evidence that this was worse than Watergate, when in fact a few weeks later he was saying privately, I never saw any direct empirical evidence that the Trump campaign or someone in it was plotting or conspiring with Russia.
Right. Collusion and conspiracy are two different things. Collusion, not illegal. Conspiracy, illegal. There was collusion. The Trump campaign met with the Russians more than 100 times, but they could not prove that there was actual conspiracy. And why? If you go to page 10 of the Mueller report, it says right there that numerous campaign officials deleted or encrypted files and emails so that the Mueller report could not see them. And they also pleaded the fifth, which, you delete emails and plead the fifth when you're totally innocent.
Samantha Power said, I am not in possession of anything. I am not in possession and didn't read or absorb any information that came out of the intelligence community suggesting collusion. Ambassador Rice, I don't recall intelligence or evidence to that effect. Former Attorney General Loretta Lynch, I can't say that if it existed or not. I don't recall that being briefed up to me. So it brings the question to light. Why then did we have many years of investigating collusion that these Obama administration officials never existed, they never saw any evidence of, but for 3 years the American people were dragged through the mud and told that their choice for the President of the United States might have been a Russian asset based on no evidence at all. This president was exonerated by the Mueller report, and there's some real questions for these individuals who are saying one thing publicly and another thing privately. Thank you so much. I think I got to all of you, and we'll be back soon.
And she streams off. Hold on, I'm trying to find that quote from Samantha Powers because it's got to be inaccurate. Talk amongst yourselves. It's all old articles. Here we go.
But
she went through, by the way, Kayleigh McEnroe went through the same spiel 4 days ago. Declassified information. And give me a link to the actual news. Okay, what am I looking at? I'm looking at just the news. Here, you guys can share it too. So let's go back to... This is from September. So what she quoted Samantha Powers as saying is probably not accurate. Let's go back to her just for a second, just so I give her the benefit of the doubt, because I might have...
Russian asset based on they never saw any yet. Why then? I can't say that if it is community suggesting collusion. Ambassador Rice said, I am not in possession of anything. I am not in possession and didn't read or absorb any information that came out of the intelligence community suggesting collusion. Ambassador Rice, I don't recall intelligence or evidence to that effect. Former Attorney General Loretta Lynch, I can't say that if it existed or not. I don't recall that being briefed up to me. So it brings the question to light. Why then did we have many years of investigating that being Mr. Rice? I am not in possession, never saw any direct empirical evidence that the Trump campaign or someone in it was plotting or conspiring with Russia. Samantha Power said, I am not in possession of anything.
Hold on, Samantha Powers. I'm going to bring it over here so you guys can see me doing this, but I am not in possession of anything. So that quote doesn't pop up on Google. That's not to say that nobody else has ever mentioned it. I mean, it pops up if you look at what Kayleigh McEnroe has said, but I would bet, well, I wouldn't bet good money because I don't have good money, but I would bet money that Samantha Powers didn't say what this Kayleigh McEnroe just claims that she said.
I am not in possession and didn't read or absorb any information that came out of the intelligence community suggesting collusion. Ambassador Rice, I don't recall intelligence.
Probably said conspiracy. I don't know. Anyway, so a little later today, I'll be doing the Billy Joel update, probably around 6 or 7 or whenever the votes end from yesterday. Let's take a look at those right now, just in case. We're done with the politics. She's ridiculous. Yeah. Oh, hi, Kitty. Do you want to come up and say hi? Do you want to smell my finger? Do you want to come say hi to the peoples? No. Cat hates you, sorry. All right, let's go to the Twitters. I think the Trump stuff is done for the day. What time is it? It's 3:07, so yeah, we're probably done. Let's just check in on his tweets right now. So, that's TDS right there. Come here. Do you want to come? Do you want to talk to the people? No? Okay. Let's go. Donald J. Trump. Remember, a vote for Mike Garcia and CA25, a really big deal for our country. Is that today? I think the election's actually today. Isn't there a special election to replace Katie Porter? Was it Katie Porter? Somebody else. Somebody who had a three-way. And it's like, I don't care. But anyway, there's a vote going on, so we'll see who wins that in California's 25. So that'll be just fascinating, and I know everybody cares about that. But if you want to vote in the Billy Joel Madness, what you do is you go hashtag Billy Joel Madness. And let's take a look at the latest, and you'll see the votes. Here, let me zoom in so you guys can see this too. Boop, boop. All right, so We Didn't Start the Fire is smashing Downeaster Alexa right now. There's 4 hours left if you want to get your vote in on that. You May Be Right is well ahead of River of Dreams. Oh, Say Goodbye to Hollywood is just absolutely crushing Getting Closer. I don't think Getting Closer is going to get much closer than that. 2 hours left in all of these. And 52nd Street, well ahead of Rosalinda's Eyes. I'm torn on that one because I find myself from time to time humming or singing Rosalinda's Eyes. I play nights in the Spanish part of town. Doo-doo-doo-doo. It's a good song. I hate to see it go, but somebody's got to go. I've never found myself humming or singing River of Dreams, just for the record. I don't want to influence you which way you guys vote. I don't vote. I could vote if I wanted to, but I don't. I'm leaving. Katie Hill, thank you. Thank you, Random. Thank you to the fact checker. I have my own fact checker at Random. It's Katie Hill is the one who's... is that today at Random? You want to check on that and see if that's the election today? I can also check on that. Katie Hill. So this is what I do. Okay. Republicans are on the verge of winning a House seat in one of the most Democratic states. Is that today then? Do you want to... by Chris Salazar. The vote is on Tuesday, the special election.
So
And
what
that was
happens
from
after you-
yesterday, so that's got to be today. Yeah, so there's a special election tonight. Yay. Something to look forward to, but it's California where they are notoriously slow counting votes, so we may not know the winner tonight at all, especially since many of those votes will be done by mail, and it takes the machines there a while to process all the votes. So that'll be interesting too. If most people are voting by mail come November, are we going to know the winner on November 3rd, or is it going to be several days and drag on just like it did Bush versus Gore? That'll be interesting. Give the news stations something to talk about. Yeah, I already figured it out at random. Wait, what's going on with Stephanie? Pancreatitis. Pancreatitis. That says tit right in there. Well, hey, you're welcome. I'm trying to make it bearable. Thank you guys for making this bearable with me. I've been going so quickly here, I've ignored much of your chat. I don't know if I can make the chat go back at all. Republicans do win in a lot of California, so I mean, it's not just all LA and San Francisco, although in the midterms, one of the remarkable things that happened was that the Democrats completely swept Orange County, which until now had been known as the Orange Curtain, because Republicans took most of the districts there, not Santa Ana so much, because of the high minority population there, but the rest of Orange County was pretty white. American people, Marfa, enjoy your beverage. So I'm going to let you guys go. I'll do a Billy Joel update apparently in about 3 hours. If you want to go vote for Billy Joel Madness, it's hashtag Billy Joel Madness. Thanks again to all of my patrons. This episode brought to you by Chris Wilson, Karen Johnson, Joanna G, Debbie Troyer, Linda R, Lizzie Dowg, Martha Lever, Rich Mack, Jan Doris, Robin Redstead O'Hare. Oh, hi, it went away. Stephanie, you're right there at the end. Hold on, I'm going to show you. I'm going to show you that I didn't forget you. Stephanie, going through what you're going right now, that would just be cruel. That's the wrong window, so I can't help you there. Get rid of that. Stop it. Oh, now it's being fussy. Hold on. I'm going to show you, Stephanie. And I'm going to give you a very special shout out right here. Okay, I'm going to drag this over. I'm going to go to close up. This is for you, Steph. I'm going to show you where I type in the specifics. And see, here's everybody. And unfortunately, the program cut you off before we got there. Boom. Shout out to Stephanie Biorgi, everybody, for being a sponsor and helping bring this broadcast to you, along with Rodney Starr and Robin Redstead O'Hearn. So you were in there, Stephanie. I'm going to start paying attention to that. I didn't realize I had so many sponsors that it didn't make it into the crawl. I hope there's a way to adjust the crawl. If not, I'll go to a system where I put fewer sponsors in there. I can't take away some of the other stuff, so I'll make it work. But thank you, Stephanie, and thank you, Rich, and thank you, Marfa, and Barbara, and Airbus for spending your time in here. Thanks to Chris for his 38 cents. Every little bit helps Chris. So I will see you guys later today. Be safe. Be happy. Don't let the bed bugs... But I got to come up with an ending. Oh, I'm going to have some credits, too. So all of you patrons will have, at the end, there'll be like a patrons, and they'll say resistors and protesters, and, you know, that'll be like, who's a protester? Debbie Troyer's a protester, and the resistors will be like whoever the resistors are. And then, like, 38 cents guy, it'll say Chris Wilson. So that's coming. Right, scrolling up your screen like this. Just imagine that. Imagine 38 cent guy. Chris Wilson. All right. Hug Steph, be well. Oh, you guys are just talking amongst yourselves. I'm just going to sit back and let you guys talk amongst yourselves. Say goodbye to each other. Hugs and kisses. You Want Your Name by RBG? I don't know what that is. Oh, you want by so if you want to sponsor something to do with RBG? Or is that wait, is Robin's name RBG? I've never put it together. No, Robin Redstead O'Hearn. So RRO for Robin. So I'm not following you there, Marfa. But yeah, if you want to sponsor something, so anybody who's a patron, you can communicate directly with me. If you write to me on Patreon, it comes to one of my special emails. And then I try and read all of those things. I don't necessarily see everything that people write to me on Twitter. But if you send an email to me through or a message to me through Patreon, I do see it. If I don't respond, send me another one because I'm supposed to see it. And, I'm so busy with work and all nowadays. I know who Ruth Bader Ginsburg is. The Belgian. You guys are doing your own thing in there. All right, I should just leave the chat room up and running and let you guys run amok. It's going to be a very, very quiet ending to the broadcast. You guys have a safe, happy day. Be good to each other. Don't drink bleach unless you have the coronavirus.